Good morning once more, viewers at home and around the world. We are very happy to be back this morning, and we have quite a full studio. And with me today is a special guest who was with us last week. We did beg her to come back today because a lot of people were demanding that they needed to hear more about how we can take care of our oral health. And she has granted our request, and here she is seated today. I'm talking about no other person than Dr. Mrs. Kehinde Umeizudike. She's an associate professor in the University of Lagos, Department of Preventive Dentistry. Okay. Also, we would like to say a big thank you to Dr. Dedeke, who was with her last week. She's not with us today. So if you're watching wherever you are at the moment, we want to say a very big thank you once more. And with us also are the regular faces we have in the house. On my right, I have slimmest of them all.
Morning, guys. Just so you guys a bit.
And then beside Chief, I have another high chief. Chief Olododo.
Elder statesman.
How the patient doing?
We are doing very good.
They are responding to treatment.
Yes, so.
Good morning, ma.
Yeah,
Good morning. Thank you for coming again.
Thank you for having me. It's a pleasure to be in your studio again.
Yeah.
You are an associate professor.
Yes, so.
He's good. Associate, Abby?
Yes, we associate together.
We'll get there.
And also, my humble self, Dr. Bartholomew Ufoegbunam. I'm the medical director of Grace Valley Medical Center here in Lagos. So today we'll be looking at oral health once more. Don't forget, March 20th was Oral Health Day, and a lot of us trooped to LUTH, Department of Dentistry, where we had our dental checks done for free without taking any money. A lot of people benefited from that, and I also want to say a big thank you to Chief for making that possible. Thank you once more. Okay, so to introduce the topic, oral diseases are said to be the commonest non-communicable diseases all over the world. It's being said that, going by the 2016 WHO released statistics, that half of the world's population, 3.58 billion people, are having one form of oral disease or the other, ranging from dental caries to gum diseases, periodontitis, and what have you. And also, I also want to point out that many of us do not understand the reason why we need to brush our teeth on daily basis. We've been advised by a doctor that it actually has to be twice in a day, not just once. Let me also give you some things that will make you that will help you to remember to brush your teeth at all times. Number one is the fact that some of us may not know that we have billions of bacteria within our oral cavity, within our mouth. There's so much that one study actually said that there are more than all the population of the whole world put together in one person's mouth. That is the number of bacteria that you have in your mouth. I also was told that these bacteria are made up of more than 700 different species of bacteria. These are things that constitute the normal oral flora. Okay? And these are the things that when you don't take care of them, they can cause a lot of diseases that oftentimes can give you a lifelong pain, discomfort, and sometimes disfigurement. Okay? So we thought today to do justice to the topic is an associate professor. So once again, I want to yield the floor to you, ma. Okay. You have the floor.
Okay, thank you, Dr. Bath, and everyone in the studio.
Thank you so much.
Thank you.
I will associate with you so that I can be associate professor.
Yes, so that you can have good oral health. Okay, so thank you. So good oral health is actually, we could simply say, is freedom from any oral problems that could affect normal functions of an individual. So anything, any disease that can cause functional disabilities, that can cause pain, or that might not even cause pain, but affect the individual's ability to chew, to speak, to smile, to interact with people, would say is a form of disease. And so oral health aims to maintain a good oral hygiene status and makes put this individual at a position whereby they can perform their normal daily functions. Now, the good thing is that most of the oral diseases that affect the mouth, the common ones, they're actually preventable. Okay. Common things like dental caries, tooth decay, gum diseases, gingivitis and periodontitis, commonly, these are preventable. And so if they are preventable, that means individuals can take necessary actions to prevent them from occurring. And when they even occur, they should also visit the dentist regularly so that they can be detected early and they can be treated. And this will reduce complications of tooth loss. Now, the most common complication that they cause is tooth loss. In fact, dental caries and periodontal diseases, particularly periodontitis, are the most common causes of tooth loss in adults. Also in children, but the other things could be things like maybe fractures, when the teeth break, and things like that. So this year's theme, which was aimed at promoting good oral health, encouraging individuals to take action about their health. Most times, the irony is that most of these diseases, they are usually painless. So when people don't experience pain, they feel like they have no problem. In fact, studies have shown, many studies we've done, when we ask individuals, why have you not visited the dentist? They will tell you.
I was fine, nothing.
And I don't break
yes. And besides, I feel there are many people also feel there are more important things that they should pay attention to. Their systemic health. Maybe people that have hypertension, diabetes, they are looking for money, they are hustling. So they feel that oral health is the least of their problems. Whereas it's actually an essential, integral part of systemic health. If you have pain in your mouth, if you've had to take before, you'll appreciate what it's like. You understand? Not being able to do anything. So I think we want to encourage people to visit their dentist and to even check their mouths themselves. It's not just when they have problems. They must understand that most of these diseases are chronic. They start slowly. And so when people have this at the back of their mind, then they would know that they should pay more attention, to their oral health.
Okay. Sorry, sir.
Okay, no, go ahead. Go ahead.
Okay, Associate Professor Ma, there is this thing with me I don't notice. So I want, because question where I get for you now is like 17. But the first one is, if person drink ice water, say if ice water, it touch person teeth, or I don't know English.
It shock the person.
It shock him, thank you. Say you do crack for the person. Is that a sign, say that teeth, say maybe they be the teeth the pain person? Because some people, I see them say they have the ability to shoe block. They go shoe block like this. But some people know we try. Me, for instance, I know we try, make I not lie. Saying a sign say that teeth you get is soon. Be ice water, I no get anything to do with teeth.
Okay, thank you.
You are welcome.
Ice water or ice water is okay to drink. Ice water, there's nothing wrong in it. Now it shouldn't be too cold. Number one, there are people that chew block like you say. Extremes of temperature, too hot, too cold. If it's continuous on a continual basis, it will also damage the teeth. After a period of time. But ordinarily taking cold water is alright. However, if you were able to take cold water before without pain, and now suddenly, if you drink hot water or cold water, you're beginning to have some sensation,
electricity
shocking sensation. It could just mean that there's something wrong with the tooth. It could mean that there's a decay, tooth decay, or there could be what we call dentin sensitivity. It means maybe the protective layer. It could mean that the protective covering, the enamel that covers the tooth surface, part of it has been removed due to some actions by the individual, and now exposing dentin, which is the inner part. Just like your shirt, it's like the enamel. Your skin is like the dentin. So if you remove the outer layer, they will begin to have sensitivity. Because dentin is very sensitive. So when you start having that, it's time for you to have a checkup.
Okay. Quickly, another one where I want. Just about no face. Quickly, another one where I want. The issue of salivating or secretion, excessive secretion of saliva in the mouth. We observe, say, when some people they talk, they pour saliva.
They come out.
So does it have? Can we link it to oral issue, or is just a personal thing? Oh, I don't want to call it over secretion of saliva, but make person they talk, make it a salivate where I don't see some people.
Maybe they are talking.
So is it just personal? I think it's just personal. It's not supposed to be a problem.
Yeah, what could happen? We could have a disease when there's not enough of the
saliva.
What we call xerostomia, dry mouth.
Xerostomia.
Yes,
that's
xerostomia.
okay.
Dry mouth.
Too much
So some drugs can cause it like antihistamines and some antihypertensive drugs, whereby the individual will not even be able to talk very well because the lubricative function of saliva is not there. You know, saliva helps to lubricate and enable chewing, swallowing, speaking.
Makes it very easy.
And sometimes too, when people have sore throat because of the pen,
they won't be able
they are
to
swallowing their
their
saliva. So it happens more in children. So they end up drooling saliva. You see saliva dropping from their mouth. Okay, so my question will dwell more on oral hygiene. I will take you back, okay? But before I do that, I want to quickly open the lines so that viewers at home can join us if you have any contribution to make. Okay, so the lines to call will be displayed shortly. And I'm sure Trinity will want to help us out.
Yeah. Okay, guys, you will see the number anytime from now, but let me just help out by calling the numbers. 081-7314-7589 and of course 081-054-3498. Just keep the volume of your TV set so that we feel related to now.
So thank you very much. I would like you to demonstrate to us today again, or maybe you can give any of us. So show the things that we learned last week.
I think, Doctor, let me thank you for sending me, because at the point I was like, oh, Doctor, why? But then I think I learned so much.
Okay, so you start by identifying them before you start the demonstration.
No, Doctor, they didn't teach me that one.
Let me tell you, Doctor, the one for the front is incisors.
No, it's not the parts of the.
Doctor, which one? You said I should show you how to try.
Front is incisors.
I want to show. This was what they taught me. Okay, the first thing I learned when I went is the fact that fine, we brush twice a day. I do that like every now and then. But I felt it was before you eat in the morning. Like you brush before you eat and then you brush after meal at night. But then I was taught that it is actually not before you eat. It is after you eat breakfast that you brush. So I was actually guilty of that.
But I have a question for you. In the situation where one did not brush the night before, and then you're waking up with this sour taste in your mouth.
What do you do?
Of course, you won't be able to.
No, yes, because I won't be able to eat with that. So I think there's an exception. Maybe you use mouthwash. I don't know. I didn't have that. Baby doctor. Okay, so guys, this is how to brush. Now, you know they brush everything together. Do you understand? You need to pick them. It depends on how you want to rock your boat. So you can decide to pick just 2 of it, and you take your time to do this. So guys, this is how it goes down. You don't do all of this. You guys don't do all of this. You do this. Can you see? Like you're sweeping. I hope I'm getting it. So after so you go all the way. You go all the way. It depends on how many minutes you want to spend on each. And then when you are done, after you don't do how do you say you will do? Okay, the down one you do it like this. Okay, the upper one is down, and then the down one is up. So then you go all easy, Dr. Matt. Then you go all the way.
And the roof of the mouth. You've forgotten that.
Yes, no, I was coming to it. And then this and this.
But can we brush the upper layer? That place is very soft.
You do it very soft. Okay, let the professional. Let's ask.
I'm talking about
you did very well.
Okay,
yes. If I'm to score you, you have over 70%.
Don't worry, you will soon join us.
I'm a matron, mind you.
Anyway, we open our mouth a little when you're brushing. And then, like she said, actually, we place our brush
at 45 degrees.
Yeah, that's Bath's method.
Okay.
But you see, why we don't want to confuse people? When you start saying 45 degrees, how would they know if it's 45 degrees? So we keep it simple.
Okay.
So we say roll method.
Below the gum.
Roll. That means you place the bristles like this on the gum, and then you make down. Okay, I want them to see.
Yes, that's in.
Yeah. Okay, like this. You make downward movements, and you make about 8 to 10 strokes on each set of teeth, like that.
That's a project too.
Yes. Oh, it's a project. By the time you do it, you would have spent about 2 minutes.
Yeah.
You understand? And then like that, away from the gum. The method you are talking about, Dr. Bath, you're also right. The first one I've described is the roll method. And you can see how your hand is rolling, your wrist, like wrist roll. The other one is the bath, which is also advised, and recommended. You place the bristles inside the space between the gum and the teeth, angulate at 45 degrees, and then you make short vibratory movement. Understand, this is not scrub motion, just on the same spot, vibrating, and then you make it down, you brush it down like that. And then the inner ones too, the same thing, downward. The principle is that all the, it's an associate. You brush them down like this. And for the lower one, you brush like this. Like this. Like this. And for the inner one, you also brush them upwards like that. And then, of course, you brush the grinding surfaces like this.
And it doesn't have to be too hard, because we believe if you don't brush hard, they are not brushing well.
Oh, no, it shouldn't be too hard.
Because when Baba Liman for our area, and then you brush like this, everybody must know that.
I have 2 questions. And the first one where I've been right here and I say...
No, she's not done on this.
Okay, she's actually not done.
Because she has some other...
Yes, and then the tongue. Gently you brush your tongue, because we have a lot of bacteria on the tongue, which can also cause bad breath. So when you finish now, because the bristles of the brush, and of course you use a medium texture, some say you can use soft. School soft
I have a problem with the soft one. Most times when I use it, it's like I'm not brushing well. So until I use the hard brush, I don't get my
wrong. You're going to hear today.
So I think we can find a balance and encourage you to use medium, not hard. And why we advise you not to use the very hard brush, and particularly people that brush like you said, if you are using a hard brush, and particularly with the wrong method or a scrub technique, it will damage the gums. It will recede the gums. There are people that have long roots, long tooth, and then also it will lead to abrasion of the tooth.
Okay, Moses from Delta. Moses, good morning.
Good morning. How are you in Lagos?
We are fine in Lagos. So how are you doing?
I'm okay, but I'm not happy with because anytime I call, they pick my call. And
so sorry about that.
Now, because billions of people in one call.
I wish you know.
Sorry, billions of people they call. No face.
Anytime they call, they pick my call. I call.
No face. No day for NCR. No face. No face.
Very good channel.
Thank you
very much.
I want to ask the doctor a question.
Okay.
If somebody they cracked it, what is responsible?
Cracked it.
If doesn't get cracked it.
What's responsible?
No, cracked teeth.
Yes.
No, cracked teeth.
Yes.
Okay, cracked teeth means broken teeth.
So you're asking what's responsible?
Or cracks. Number one, it could be that the diet is too hard. People that crack, they like to chew bone.
Making person live
too much.
That's my question. I have a question relating to that.
Of course, you can eat your chicken, your meat, little bone, but not crack. There are people that sit down, and what they are doing, they want to descend on the meal and crack the bone. The force it can apply can lead to...
Okay. Do you have other questions?
That is chewing the ordinary way. You are not eating anything and you are chewing your teeth.
Okay, you're just chewing.
Yes.
So don't be saying you chew bone.
No. Just ordinarily when I sit down, I just chew my teeth like that.
Okay,
so it's just chewing, not...
Okay, that's one.
Making
another thing is noises. There are also people that they practice what we call bruxism. They are clenching a lot. They have that habit. Maybe they get angry or they are tense. Even at night,
they find themselves doing
they are cracking. Of course, that would, they are chewing, grinding their teeth together. That also can lead to cracks.
Okay.
People that when he doesn't, like he said, I don't know, he himself said that, so it's a habit and it can be broken. We can make protective guards. Okay. And then we need to sometimes even counsel such people. It could be that they have some, maybe anxiety.
Yes.
That a counselor can help, a psychologist.
Doctor, please, before she continues, now my question is actually relating to what you just said about cracking of bones. Now there's this African mindset that when you chew biscuit bone, I don't know who gave it the name, but you know that very soft bone, that it has a way of strengthening your teeth. So how true is that? And then secondly, even outside the regular biscuit bone and all of that, they feel okay when you chew chicken bone, all of those things, it helps in strengthening your teeth. So is it true?
It helps because of the calcium. Calcium is good for the teeth. So it's okay. It's okay. It's good. But again, like we say, too much of everything is bad. Okay. So if you take your biscuit bone, you chew it, you know, it's not out of place. Okay. But if it becomes excessive and a habit, lifelong, then it could
they even break this problem. Don't break my
chewing of gums. Chewing of gums.
Okay.
Any health implication, ma?
Chewing of gums is good as depending on the kind of gum you are chewing.
Chewing gum.
Yeah, it could be an exercise. Some even say that it keeps their mouth fresh.
Yeah, because my mucus, they shop gum. They say they take control hypertension when they walk.
Right? Maybe it helps him when he's exercising. But what we encourage, you must chew your gum is sugar-free chewing gums. Okay. I don't want to promote any, but those that have.
Thank you. Just a minute. Joshua from FCT. Joshua, good morning.
Joshua. Good morning, Anthony Joshua. No day.
It seems as if we lost a caller.
I want to know you people's stand. That's Lebu, doctors. What's your stand on Paco? Okay. Because when we do for you, don't go yarrow stick.
Yes.
You know hold that. You go make mouth. Why everywhere you go? Even we normally feel the flora on the tongue. I don't know. Maybe they advisable now. Make a person still a shop. Don't go yarrow or Paco. Waiting be on our own point for Paco.
Okay. Our position is that it is good if it is done properly.
Okay.
That's our position, because there are some people in the rural areas who may not have access to toothbrush. Even if they have the toothbrush, they don't have access to the toothpaste continuously. So if you must use
affordability could be a problem.
It could be a problem, really. So if you must use the chewing stick, the Paco, there's Paco Ijebu,
there's you know Ijebu.
Paco Ijebu, Paco Dudu.
Yeah, it's in law. You have gone. Paco Dudu.
We have Kingsley for Kogi.
For the elders.
For the others.
Hello, Kingsley.
Hi. Kingsley, how you doing? Kingsley.
Hello.
Yeah, good morning, Kingsley.
Good morning.
Okay, please go on with your question.
Good morning.
Morning. Go on, please.
I'm not so stupid. One of my eyes, whenever I'm eating, one of the eyes, one time.
Can you speak a little bit louder?
Yes. I have problem on my eye, one of my eyes. Whenever
Okay, I think he said he has a problem with one of his eyes. Okay.
Can you hear me now?
Yes, I can hear you. What's the problem with the eye?
When I have the accident one time with that, but it's not that it's not whenever I'm eating.
I could barely hear you.
I think he's trying to link his eating with the eye now. That whenever he's eating, he feels pain
on the eyes.
Okay, if that's that's what it's inferring, it could be that there's a problem with the tooth. Sometimes severe pain can be referred to the eye, to the ears, to the jaw, to even the head, causing headache. So it could be that there's a problem. It needs to see a dentist, to attend to.
Maybe yes.
The chewing stick. Maybe I should just quickly finish. The important thing is to also make sure you chew the ends of the stick so that it becomes soft.
Okay.
And then you now take it, and now with the end like that to clean again
individually.
Yes, but it's going to be a bit more difficult, I must tell you, if you agree with me, rather than the bristles, to use, because most people, like Dr. Dedeke, you pointed last time, people do is they just chew on one spot and they are busy, tying wrapper. You remember all those stuff? Yes, not really using it round. But ideally, you should chew it. Make it soft, and then take it round the teeth like that individually. and that might take some.
But
some
keeping
time.
in mind that we need to use a fluoride containing toothpaste.
Yes.
Chewing stick does not contain fluoride. So
Well, most
guide
do not contain. I mean, we don't have the scientific backing.
It gets fluoride.
It doesn't. So what we advise people, of course, this is what is recommended: a toothbrush with a fluoride containing toothpaste. That's still recommended to prevent tooth decay and all that. However, for people that do that, so they may use the toothbrush maybe once, and they might end and use their chewing stick. They can combine it. That's what we are saying, because it also has some antibacterial activity. Those are chewing sticks, so they should balance. They can also put some toothpaste on the chewing stick. And also, really? they can do that. Yes, to serve as the fluoride.
Okay, still talking about toothbrushes now. Yes. I do know that there are some electric toothbrushes that actually does the movement by itself instead of the person. Is that advisable? Uses but and Joshi will tell us.
I mean, I've used them.
Which is preferred?
Some studies have shown there's no difference, but again, it's preferred. I think it's a matter of preference, or for certain people who may have manual dexterity, maybe people that have cerebral palsy, maybe Parkinson's, have challenges. Then they might benefit from power toothbrushes.
Okay, I have a friend that has a problem, and it's been a long time problem. And as a matter of fact, the guy is a celebrity. Now he gets this very bad breath. So most times he's always on mint, and he has done like a whole lot to come out of it, but I don't know why the thing is still there. So what is actually responsible for that? Is it, I don't know, is it hereditary? I don't know, what can he do?
If he cured the bad breast.
And he has visited.
Yes, he has. So it's always on mint. What's responsible?
Because bad breath. Halitosis.
There are many causes of halitosis. The most common causes are intraoral, that is within the mouth themselves. It can be from tooth decay, caries. It can be from gingivitis, gum disease. It can be from periodontitis. Periodontitis is the more severe form of gum disease that affects the supporting structure, the bone, and it forms pockets. And when these pockets form, food can pack in between them. And because it's chronic, many times the early stage is painless. Most people don't even know. And so, again, those are common causes. Other things could be abscesses in the mouth, things like that. But it could also be systemic. People that have things like uncontrolled diabetes, they have this acidotic breath. People that have like some liver diseases or even kidney diseases, they could also present with halitosis. And maybe then diet, what we also take. There are people that eat a lot of garlic.
Is it bad?
It's not that it's bad, but again, you need to brush because it has this gas. This
could be offensive.
Offensive. Yes.
Davidson.
Hello. Good morning.
Good morning, sir.
I'm here. Can you hear me?
Yes, we can.
Okay. How is it today?
Oh,
we are fine.
Speak up, oh.
Okay. I'm fine. God bless every one of you.
Thank you, sir.
So my question is actually, there are two questions.
Okay.
Number one is that normally when I brush, though I don't brush the way you explain, doctor, the way you explain. So, but normally when I brush, I normally see something that looks like when I brush very hard, I feel that I need to brush very well. Some kind of reddish other blood on
it's blood.
it normally comes out before I raise my mouth. And when I brush my tongue, I brush it very hard so that anything there will go. I don't know if those ones are good. Do you understand my question?
Yes, we do.
That when each time I brush and I see my feet mixed with reddish weather blood. I don't know what
obviously blood.
Okay, so ma.
Is it right?
Okay. Is that all?
The second question is the matter of, I noticed that I don't know the best toothpaste to use anyway, so but I'm using oral, but let me know.
Hey, you understand? Thank you. Okay.
Don't promote anyone.
Anyone. Thank you for your question. When you brush and you notice, you said something red, that's blood, likely, most likely, which is a sign that you have gum disease. And if you have gum disease, you need to have it treated by visiting the dentist. Maybe it's time for your washing if you've never cleaned your teeth before professionally. So you need to come. One of the earliest and commonest signs of gum disease is bleeding, particularly while brushing. And so that's a pointer already that there's something going on. It's not normal. But of course, if you use a very hard toothbrush too, it could traumatize. But what you are noticing consistently is a sign of gum disease. And then brushing your tongue, you should brush your tongue. But if you no, you shouldn't do it too hard, because if it's too hard, you could damage and injure your gum. And that could lead to an infection and even bleeding. So,
Doctor, still along that line. Sorry.
Yes, sir.
Now, we haven't finished. We are not yet done with the instruments you have here. But because you mentioned tongue, there's this instrument, if I use that word, that they call tongue scraper.
Yes.
What is the need of that?
Okay.
If we can use our toothbrushes, do we have extra need to get a tongue scraper?
Okay.
And then how often should we do flossing? Okay. And then this tiny toothbrush, is it advisable we all get it?
Okay.
And then I think these are the same thing.
Yes.
Okay.
Okay, let me start with what was the first one?
You say a person is supposed to get tongue scraper.
Yes, the tongue scraper is actually what is actually recommended for cleaning the tongue.
And not the toothbrush.
Yes, and I have one at home. I just didn't bring it. Yeah, you know, it's just a plastic instrument that is smooth, has a smooth end, and you just use it to scrape.
How do we use it?
Tongue. Well, assuming this was it, it's wide. It has a wide base, you know, so you just gently make a forward movement on the tongue, excuse me, and then to clean it just like that. But it has a wide base.
Which should we do first? Brush the the teeth,
you can brush
scrape
first.
the tongue.
You brush first, and then you now scrape the tongue.
And also along this line, how often should we use mouthwash?
Okay.
A lot of us use it every day, or even
some will even use it after brushing.
Twice a day. Is it advisable? Does it have to be on a dentist recommendation?
Ideally, it should be based on dentist recommendation.
Really?
Because they are
really
no, for instance,
we feel it's a way of life.
No, it shouldn't
seriously,
be.
because we'll be using it from secondary school, so we feel it's just normal.
Why we recommend it, for instance, people that have maybe sores in their mouth and they may not be able to brush very well. So the antibacterial component of the mouthwash would help to prevent plaque buildup, the plaque biofilm that causes the gingivitis. So it's important. So that's why we recommend the mouth rinse. Or people that have ulcers also in the mouth, or even people that have puffy gums, you know, just to help to reduce the inflammation, you can use it. Some people use it because of to improve the freshness of their breath. But really, it's not something you should use on a long term. Because again, if you use it for a long term, it may even be associated maybe with even growth of fungal infection like candidiasis.
Okay.
So
as I say, Prof. Sorry, ma, quick one. I want to ask you two at a time. At times, something they do person for tongue like this. You buy the color akuta one. We go be like stone for the tongue. You go
like blisters.
I know you know blister. You go be like stone. The thing go call. You go know it's a stone. You go go for
growth. You won't be able to take pepper.
Majata. So we dey call am majata. The wetin dey cause am one. Then number two, cracking of teeth when person dey sleep. Being about Jane, say is it something where it gets solution? If person dey sleep, they do.
It has.
They do that and
for the tongue, it may be that there's an ulcer on it. It could be an ulcer. You know, that's like a wound on the tongue.
You can
and when it gets swell small,
it could, and it could also be trauma. You understand? Some people that take very hot things, it could lead to trauma, and the place may swell. And of course, it needs to be treated. We advise such people again visit your dentist so that they can check what exactly is the cause, so that you not do self-medication. And cracking of teeth at night, grinding, there's solution. Stop it. You have to still come for us to know why.
Whether it's spiritual.
Yes, you have to come. But again, we have some mouth guards that we can fabricate to help to reduce that activity. But it may be due to, like I said, anxiety, you know, I mean, depression. So you might need to come to us and we'll see a clinical psychologist.
Apart
from brushing now, because the brush may not have gain enough access, may not gain enough access to in between the teeth. That's why we talk about interdental cleaning aids. The most recommended is dental floss. Interdental floss or dental floss, which is like a thread. That you can, some come in threads and you cut them and then you use them. But or they come like this flossets. And you use this, and then you place. What you do is that you should do it at least once a day. Some say you can do it twice, but at least once a day. It can be last thing at night after you brush, and you take this down in between the teeth to remove gently, without a snapping motion, because it can also traumatize the gum. And then adapt, and then try to take it up to remove the plaque. Of course, if there's meat, fish that gets
everything is in a meat, then they take and come out.
Many people use it for that. Like you use it around all your teeth. It's not just when there's meat or fish or corn or things like that.
Because that's when I find myself using it.
Yes, most people.
That's when I do it.
Doctor,
and then this is interdental brush for people that have spaces between their teeth, whereby this may not be that effective, then we recommend interdental brushes.
So where can we get this?
It's available in very good supermarkets. It should be available. And then
I don't know, what's your impression on salt water, warm water and salt for toothache? Because I think I've done it before. You know, that was like the first day treatment for me. So is it good? Is it advisable?
Well, warm water solution.
Warm saline.
Warm saline. Okay, warm saline solution. We advise, particularly if there's maybe an infection, of the soft tissue, maybe the gum, maybe the oral mucosa, the cheek. But however, it's not something we just prescribe and just tell you warm saline. You need to see the dentist. The only thing is that it helps to facilitate healing. And the salt, of course, has antibacterial action. So if sometimes it's a remedy that people can use if they don't have immediate access to the dentist, and then you now visit your dentist
later.
Okay, thank you very much, Ma. How often, 2 questions in one, how often should we change our toothbrushes? That's number 1. Number 2, looking at these teeth, usually for some people, when we are getting older, we discover that the gum begins to go down. And then the teeth becomes somehow elongated. Begins to go down, and the teeth becomes somehow, it's called gum recession, if I'm correct. Now, what are the causes of gum recession? And what are the remedies? What are the treatments? And then, is there a place for herbal remedies when it comes to gum recession? I read 1 or 2 things. I read 1 or 2 things. When they said the use of baking soda and then with coconut oil.
Yes, Aisha is calling us from Ekiti.
Aisha. Good morning, Aisha, baby.
Good morning.
How you doing?
I'm fine, no.
Oh yeah, go ahead.
Yeah, good morning.
Good morning, Aisha.
Please, I want to ask my daughter said this when the teeth want to grow, it normally takes like 3 to 4 months. Good morning.
Are you the cause this problem?
Lower the volume of your TV.
So what's the problem? You say they take 3 to 4 months before it grows.
Yes, before the teeth grow, when it's caused.
How old is your child?
It's 9 years.
What me? 9, Abi?
9 years.
9.
Yes, 9 years.
9 years, okay.
Okay, well, it depends. Okay, thank you. On which set of teeth? Normally, for the permanent teeth, we have the baby teeth, milk teeth, and the adult teeth, the permanent teeth. The baby teeth start from about 6 months, but the first permanent teeth starts erupting from about 6 years of age. So there are people that are early, but it's 6 to 7 years, and different teeth erupt at different times. We have different eruption dates. So the teeth, and there are some, the upper ones, for instance, they erupt about 8 to 9 years. So again, some people are early. By age 5, they've erupted. So if there's a range of maybe 6 months, a year, we could have that, variations about a year plus, then it's all right. But I think importantly to know which teeth she thinks, have maybe delayed eruption, she needs to visit the dentist. It may not be anything to worry about, but she needs to visit so that we can check if it's something we need to reassure her that is going to erupt. Or we investigate and take x-rays to see.
How many times would they change brush according to
ideally every 3 months or less.
3 months?
Yes, or less, depending on how weak the bristles are.
3 months, doctor.
3 months. How much? Toothbrushes are not too expensive.
50 naira.
No, I use
every 3 months, or when the bristles are splayed, when they are flattened, they are not as effective. So you should change them. Sometimes some people change after a month. It depends on how effective. Then the second thing, gum recession. That's actually an area of my interest. Gum recession, of course, is when the gums recede and the tooth appears longer. What could cause gum recession? Number one, the wrong method and technique of brushing. If you
use of hard bristles,
hard bristle toothbrush, very abrasive toothpaste.
Dr. Bar, time and it
can be treated. That's the good thing. We have some corrective surgeries we do. Plastic surgery. That is
You always have questions.
Thank you, viewers.
You always have questions.
So thank you, viewers at home and around the world. So at this time, we want to draw the curtain on today's program, and we want to say a very big thank you to Dr. Mrs. Umeizudike, who has been with us for 2 weeks now.
Associate professor.
Thank you very much, man. She's an associate professor with you. Okay, Chifo.
Thank you for having me.
Thank you.
Guys,
3, 1 to 2, guys. Thank you for watching. Bye.